with the what? The food they are going to take. So today we want to know, I'm going to teach you how you can count your carbohydrates so that in every food you want to eat, you know the quantity of carbohydrates you are taking to be able to know the amount of insulin you are going to take. I hope you understand this. If you don't understand, you raise up your hand. So our topic today is carbohydrate. Okay. Now, when it comes to insulin-dependent diabetes, say that it's commonly known as type 1 diabetes, and it's an autoimmune condition where the body's immune system attacks and destroys the insulin-producing beta cell. And so, as a result of that, the body is unable to produce what? Insulin. This is a hormone that is regulating the blood sugar level. Now, let me explain. Now, when we eat food, you understand, especially food that contains carbohydrate, it is being what? Broken down, and the end product of carbohydrate is what? Glucose. Are you getting me? Now, this glucose is being what? Absorbed in the body for what? Energy. Now, in a situation, the hormone that helps this glucose to be absorbed is what? Insulin. And so, since the insulin is no longer being what? Produced, what happens? The sugar or the glucose will now be in the what? In the bloodstream. You understand? Causing more problems. I hope you are getting it. So that is the case of the insulin-dependent diabetes. So, but if we control it well, we'll be able to do what? Manage it. So when sugar is properly controlled, it supports growth, learning, energy, and overall well-being of what? Children. So even as a child that is living with what? Diabetes, when it's properly controlled, you see that you can achieve whatever thing you want to achieve. If you want to be a doctor, if you want to be a lawyer, whatever, you can achieve whatever thing you want to achieve as far as you will manage properly. I hope you are getting me. The poor control leads to complications that might affect the eyes, the kidneys, the heart, and nerves later in life when we don't manage it well. Do you understand? You see that later in life it start affecting our eyes. You see some persons, they have an eye problem. Why? Because this diabetes have gone to do what? Destroy the cells that connects to the what? The eye. Before you know it, you start having what? Eye problem. When it destroys the cell leading to the kidney, you see the person having what? Kidney problem. Most of the patients, kidney patients, you see that most of them is as a result of improper management of what? Diabetes. So as a child, even when your parents is telling you, don't eat this, eat it, you have to do what? Obey instructions, because whatever you eat now will determine what will be what in the future. So it's better you do what? Eat appropriately. I hope you are getting me. Next slide. Now, carbohydrate counting. What is carbohydrate counting? Carbohydrate counting is a method of calculating grams of carbohydrate consumed at a meal and snack. Now, for example, they brought this food. For you to, when we talk about carbohydrates, to calculate the amount of carbohydrate that is in what? That food. For example, I want to eat rice. What is the amount of carbohydrate that is in this rice that I want to eat? I hope you are getting me. You want to eat beans. What is the quantity of what? Carbohydrate that is in that what? Beans. I want to eat yam. What is the amount of what? Carbohydrate that is in that yam. So when we talk about carbohydrate, it's calculating the amount of carbohydrate in gram that is in that what particular food. And it is a meal planning tool that helps individuals with diabetes or those who want to manage their blood sugar level, track the amount of sugar consumed. Next slide. Now, effects of carbohydrates on food. I say food has a direct effect on blood sugar level. When you consume carbohydrates, they are broken down into glucose during digestion. Glucose is absorbed in the bloodstream, causing what? Blood sugar was rise. Now, when we eat food, like I've explained, especially those that have what? Carbohydrate. Now, the food is being metabolized, and the food is being broken down and it's absorbed. So, it means what is being absorbed, the sugar what? Increases. I hope you are getting me. For example, now, if I check my sugar level now and it is 3 points, after eating, especially maybe after eating a carbohydrate food, maybe rice or yam, and then after eating it, maybe in the next 1 hour or 2 hours, you see that there will be a spike in my sugar level. I hope you're getting me. Then, to manage type 1 diabetes, parents must inject insulin. So for type 1 diabetes, there must be what? Insulin. Now this insulin will help to do what? Regulate the amount of sugar. Like I explained, for somebody that is not with diabetes, after eating and the sugar what? Rises, the insulin will take this glucose from the blood to the cells where they are needed for what? Energy. Are you getting me? So, but in terms of type 1 diabetes, where there is no insulin, once the sugar rises and there is no insulin, what happens? The person will be weak because the cells don't have what? Energy to do what? Perform. You see the person, when the sugar level is high, the person will be feeling weak. It's not that you are feeling weak because there is no sugar, but because what? There is no insulin to take those sugar to the cells where they are what? Needed. And what is needed to do that is what? The insulin. So that is why you are giving insulin to be injected to help do the work of what? To do the work of the one that is not in the body, to be able to take those glucose to the cells where they are needed for what? Energy. Now, parents and caregivers play a central role in helping the child maintain a balanced blood sugar, steady growth, and overall well-being through proper meal planning. When we plan our meals very well, we'll be able to do what? Manage our parents. If we do not plan the meal very well of the children, you see that it will be very difficult to manage their what? Blood sugar level. We need to plan it. What would they eat in the morning? What would they eat in the afternoon? What would they eat in the evening? By so doing, you'll be able to calculate, know the amount of insulin you are injecting, know the amount of food or the quantity you are giving to that child. Next slide. Now, when we talk about balanced meal, we talk about carbohydrate, protein, fats, vitamins, and what? Mineral. Now, yes, we are managing diabetes. That doesn't mean that we should not eat what? Healthy. I hope you are getting me, because what most parents do is they don't focus on the diabetes. They forget about the other part of the world, the nutrients. And we know that these are growing children. They need all these what? Nutrients to grow very well. I hope you're getting me. So once they are managing the diabetes, also consider other nutrients, which are the protein, the fats, the vitamins, and what? Mineral. With this together, they will be able to do what? Grow healthy. Do you understand? Then we talk about carbohydrates. See that 40 to 50% of the what? Total calories should come from what? Carbohydrate. And this type of carbohydrate, examples will talk about the whole grains, the fruits, the milk, the legumes, then the high fiber, low glycemic index option to help prevent sudden sugar spikes. So why do we recommend these sources of what? Carbohydrate? Because they are high in fiber, and fiber helps to do what? Regulates the sugar level in the body. So when you are eating carbohydrates, make sure you sort for what? Those that are high in what? Fiber. I hope you are getting me. Then for the protein, it helps to support the what? Growth. We talk about growth. When you talk about growth, you talk about what? Protein. So without protein, the child will not grow what? Properly. Then we talk about the healthy fats. Now, fat helps in what? Vitamins, what? Absorption. So without fat in the body, some vitamins, especially the fat-soluble vitamins, which are the vitamin A, the vitamin D, the vitamin E, and the vitamin K, will not be absorbed properly in the body. Then we also have vegetables, like the non-starchy vegetables like spinach, okra, cabbage, cucumber, and all that. Next slide. Next slide. Now, look at this plate. We call it my healthy plate. If you look at this plate, you see that part of the plate is what? Fills up with what? Vegetables and what? Fruits. Are you getting me? But if your plate of food is not like this, that means you are not getting it right. I hope you are getting me. If your plate of food is not like this, you are not getting it right. So we say that in your plate of food, half of your plate should be what? Carbohydrate, should be fruits and what? Vegetables. Then the remaining, that half, you divide it into water. That water should be what? Your grains, maybe your carbohydrates, your staples. Do you get me? And then the other one is what? Your protein. Remember, you also have your water to to drink. Are you getting me? So when your plate is like this, it means that you are eating what? A balanced meal. I hope you are getting me. So this is like my healthy plate model. Next slide. Now, why do we count carbohydrates? Remember, our topic is carbohydrate counting. Why do we count carbohydrates? One, it helps to match insulin doses to the amount of carbohydrate eaten. Now, before you inject insulin, you need to know the amount of carbohydrates you have eaten, so that insulin will be able to do what? Regulate it. I hope you are getting me. For example, if I'm taking 100 grams of sugar, carbohydrates, I should be able to take the amount of insulin that should be able to do what? Control that 100 grams of what? Carbohydrates. Do you understand? So that there will be no sugar spike in our system. It will be what? Moderate. I hope you are getting me. Then the second reason is that it prevents what? High or low blood sugar. Because if you do not calculate your carbohydrate very well, for example, if the amount of carbohydrate eaten is lower than the insulin you are taking, it means that it will bring down your sugar level, which is what? Hypoglycemia. And if the carbohydrates you are taking in is higher than the insulin you are injecting, it will bring about what? Hyperglycemia. That is, your sugar level will be what? Very high. Do you understand? So you will need to match it so that the amount you are taking should be able to do what? Regulate the what? Insulin and the sugar level you are what? Eating. Are you getting me? Then the second one is that allow flexibility in food choices. Now, when it comes to type 2 diabetes, we talk about avoid this, avoid that. Do you understand? Eat only plenty of vegetables, don't eat rice, don't drink mineral and all that. But children, imagine a child not having the experience of eating banana, licking sweets, taking juice. Do you understand? With that, you see that they will feel that most of them will feel depressed, like maybe they are not part of the world. Are you getting? But with carbohydrate counting, you can actually give them a little of those favorites. Are you getting me? With carbohydrate counting, you'll be able to know, okay, let me give you little, because you know the amount you are giving. I'm not saying that you'll be licking sweet all the time. Do you understand? But what I'm trying to say is that it allows flexibility in their choices. You'll be able to make other choices apart from only, you see some diabetic patients, when you go to the clinic, they'll tell you that it's only beans and plantain they are eating. And that is the only food they are eating. They will eat plantain and swallow, maybe in the evening. Plantain, what is it called? Pollen in the afternoon. Plantain porridge in the morning. Beans in the morning. Moi moi in the afternoon. Like that. Moi moi, beans, like as in beans and plantain only. They don't have options. They will tell you that maybe this one has sugar. I don't want to eat rice. I don't want to eat yam because it has what? High carbohydrates. But that is not for children. Though we don't encourage eating only plantain and what? Beans. Do you understand? But we see most parents too, they also imbibe that culture in the children. Because maybe their sugar level is high, they only restrict them to what? Beans and plantain. No. You have to be what? Flexible. Give them rice, give them yam, give them beans, give them all varieties of what? Food. Then promote independence and self-confidence for both child and what? Caregiver. Now, with this carbohydrate counting, even the child can be able to do what? Calculate his what? Carbohydrate. And be able to know, okay, I've taken enough of this. If I take 1 finger of banana, is equal to what? 15 grams carbohydrate. I hope you are getting me. It makes them to be what? Independent. And know that, okay, they will know the quantity they are taking. They can actually inject themselves with insulin while knowing what, if they know the what amount of carbohydrate they are what taking. I hope you are getting, even as you as a caregiver, as a mother, you know the quantity of carbohydrate you are giving to your child. You know the quantity amount of insulin you are supposed to do what inject. So it makes you what promote that what confidence. Now, how to count carbohydrate? One. First of all, how do you now count carbohydrate? One. Establish a meal plan This is done by what? Registered dietitian nutritionist. For you to know what your child needs, you must go and consult what? A dietitian. To be able to do what? Plan the meal for the child, because each individual has particular what calorie for placement. The calorie I need is different from what the other persons need. So when the dietitian plan the what meal, be able to calculate the calorie what that child needs according to his age, his sex, and activity level. Then from there you start calculating. Then the next slide. Second, we need to do what? Identify all the food that has what? Carbohydrates. What are those food that contains carbohydrates? If you know them, so that anytime you want to eat them, you say this food has what? Carbohydrates. Now, what is the amount of carbohydrates in it? Now, for example, fruits. All fruits contain what? Carbohydrates. I hope that is entering. So if you want to eat fruits, know that it contains what? Carbohydrates. I hope you are getting me. Then the second one is what? Starchy vegetables like we have potato, corn, beans, cocoyam, yam. They all contain what? Carbohydrates. They also have non-starchy vegetables like cucumber, tomatoes, cabbage, carrots. They also contain what? Carbohydrates. I hope you are getting me. Then the next one is what? The starchy foods like the bread, the cereals, the rice, the pasta, the plantain. They all contain carbohydrates. Then the next one is sugary food like the candy, the cake, the buns, donuts, and all that. All contains carbohydrates. Then the next one is the milk and yogurt. They all contain carbohydrates. I hope you are getting it. So these foods contains carbohydrates. Next slide. Determine the serving size. Determine the what? Serving size. Now when we talk about serving size is a measured amount of food or drink. Like you have on this table, you see a serving sizes of different what kind of food. Now you have banana. Are you seeing this banana? It's measured. If you watch, you see 65 grams of what? Banana. And this quantity or this gram of banana contains 15 grams of carbohydrates. I hope you are getting me. So, first of all, we need to do what? Know the serving sizes of these foods that contains what? Carbohydrates. Are you getting me? Then you have and the third cup of what? Yogurt is equal to what? 1 serving. Then we have, and this servings contains what? 15 grams carbohydrates. Are you getting me? Then we have 1 slice of bread contains what? 15 grams carbohydrate, and it is what? 1 serving. So if you are eating like 2 slices or 3 slices of bread, maybe in the morning they are giving you 3 slices of bread, you can actually calculate a slice of bread is what? 1 serving, and it contains 15 grams carbohydrate. Since I'm taking 3 slices, how many grams of carbohydrate does it contain? Who will tell me? If 1 serving of bread, 1 slice of bread is 1 serving, and 1 serving is 15 grams carbohydrate. If I'm taking 3 slices of bread, how many grams of carbohydrate am I consuming? 45 grams, very good. Then you have a boiled rice. Look at this cup. If you go to the cake shop, they sell this cup. It's not just half, they have many of it. This is half cup. After cooking the rice, boiled, you measure this thing. It's equal to what? 1 serving. And it's equal to what? 15 grams carbohydrates. Are you getting me? They also have yam. So most staples, when you measure half cup of what? This half cup, it contains what? 15 grams carbohydrate. Next slide. Then the fourth one is measure what? Portion. Now a portion is the amount of food one chooses to eat at one time. For example, like I showed you this banana, I did not say you should just take only one. Like when if I teach people about servings, I don't, how can I eat only one finger of banana? Do you understand? But then you can decide to take 2 or 3. Do you understand? For example, in a meal, I decide to eat maybe half cup of rice. Then I take 1 finger of banana, and I take half cup of beans. Do you understand? These 3 things now have made it what? A portion. Are you getting me? But one is what? A serving. But combining the different kinds of food in a meal makes it what? A portion. So what is the portion you are taking? That's why we talk about portion control. So when you know the serving, you are able to know your what? Your portion. I hope you are getting me so that you will not go what? Overboard. Then, like for instance, I said 1.5 cup of rice is equal to what? 3 servings, which contains 45 grams of what? Carbohydrates. Half cup of beans plus half cup of rice plus 1 cup of cooked vegetables will give me what? 40 grams carbohydrate. Now when it comes to vegetables like ugu, water leaf, green, when you cook it, cooked one, this cup is equal to what? 1 serving when it comes to vegetables. And that 1 serving for vegetable is 5 grams carbohydrate. Are you getting me? But if it's raw vegetables, like that, even that oko, 2 of it will make 1 serving. I hope you are getting me. 2 of it will make 1 serving. And that 1 serving is what? 5 grams carbohydrates. Now, vegetables contains is low in carbohydrates. That's why you see a large quantity of vegetables giving you what? A smaller quantity of what? Carbohydrate. So that's why you say eat more of what? Vegetables, because they contains lesser what? Carbohydrate. I hope you are getting me. Then, next slide. Okay, go back. Now look at this. It's food guide pyramid. This is a food guide pyramid. It can also give you an insight on how you can go about your what? Diet. Do you understand? For instance, you see that pyramid, the top side, you see fat, oil, and sweet. Means that you should be taking sparingly. Not something that you're taking plenty. Then you have your milk, yogurt, and cheese. We talk about 2 to 3 servings. 2 to 3 servings. And I say that for milk, 1 cup of milk is 1 serving. I hope you are getting me. For yogurt, 1 cup of yogurt, 3/4 cup of yogurt, 2/3 cup of yogurt is what? 1 serving. So in a day, we're supposed to eat this. I hope you are getting me. In a day, you should be able to take milk and yogurt group 2 to 3 servings in a day. In a day, you are supposed to take meat, fish, poultry 2 to 3 servings in a day. Now we'll talk about the vegetable group. You have 3 to 5 servings in a day. Then fruit, we have 2 to 4 servings. And then we have the bread, cereal, rice, and pasta group 6 to 11 servings. But most times you see us neglecting these servings. We only focus on this. Bread, rice, and all that. Use it and fill our plate. But when we consider other ones like the fruit, the vegetables, the milk, and all that, you see that your plate will be what? Full. Are you getting me? You see some person, I don't want to go and meet that dietitian. She will tell me go and eat small food. It's not about small food. We tell you the quantities so that you don't just eat one particular word food. For example, like I said that this is what? 1 serving. I don't expect you to take 1 serving of this. You see some people, they will take up to 20 of this at a meal. Are you getting me? But if, imagine you have your vegetables, you have your fruits, you have your milk, you have your water. You see that 20 have what? Reduced. Are you getting me? So this pyramid gives us what? A guide on how we can what? Select our what? Food. Next slide. Now Now, reading food labels. Now, also have products that we buy that doesn't have what? That have that are sachet, that are packaged. This food, if you check the back, you see nutrition information. In that nutrition information, that's where you get the amount of carbohydrates that food contains. I hope you are getting me. So when you look at it, for example, I forgot something. I said I would drink something. Maybe a sachet of milk. You want to drink tea and you have a sachet of milk. What you have to do is look at the back of that milk. You see where they write nutrition information. You see carbohydrate, protein, fat. Look, when we talk about carbohydrate count, we are focusing only on what? Carbohydrate. So go to the carbohydrate, you see their amounts in grams there. Are you getting me? Some products will give you amounts per 100 grams. If they write the amount per 100 grams, what you are going to do is look at that sachet of milk. What is the gram of that milk? For example, this is the sachet of milk. And this sachet of milk is what? Let's say 12 grams of milk. And what they wrote on the packet is what? Per 100 grams, maybe per 100 grams of milk, carbohydrate contains 20. In it is what? 20. But I'm taking one sachet, which is 12 grams. So what do? If 100 grams of this milk contains 20 grams of what? Carbohydrate. What will this 12 grams that I want to take gives me? We do cross multiplication. Do you understand? When you do that, you get the amount of carbohydrate that particular quantity you are taking will give you. But other products will also give you per that gram, per serving. So you don't need to do what? Stress yourself. I hope you are getting me. So, like I said if a child wants to eat a biscuit and the total carbohydrate per pack is what? 10 grams. If the child decides to eat two, that means that the child has taken 20 grams of what? Carbohydrate. So, when you are also eating, maybe you want to eat biscuits, check the pack so that you'll be able to calculate. I hope you are getting me. Then next slide. Then use tools like food scales, measuring cups, these help to facilitate accurate calculation. With this, you'll be able to know your what? Calculation. Like I was using cup and tell you that half cup of rice gives you 15 grams. Do you understand? That half cup, I can swear what? Measure it with what? Weighing scale. So that when you are cooking, you are dishing it for your child, you'll be able to measure it, the accurate what? Measurement. I hope you are getting me. Then we also have the spoons and everything. This will give you what? Accurate measurement. Next slide. Now, when you have finished calculating, with all these methods I explained, this is a method of what? Calculating. So when you have known all this, you'll be able to do what? Add up the total carbohydrates you want to what? Eat. For instance, I want to eat half cup of cooked what? Rice, which is what? 15 grams carbohydrates. I'm adding one small banana, which is 15 grams carbohydrates. I also want to eat it with beans, half cup of beans, which is 15 grams carbohydrate, and 1 cup of cooked vegetable, which is 10 grams of carbohydrate. This 1 cup is 2 of this. Remember that this cup I'm holding is half cup. So 2 of it will make what? 1 cup. I hope you are getting me. So we say that 1 cup of cooked vegetables is what? 10 grams. So when we total, you see that the total carbohydrate this person wants to eat is what? 55 grams of what? Carbohydrate. I hope you are getting me. If you are confused, let me know. Next slide. Then match with what? Insulin dose. Now the healthcare team provides a carbohydrate to insulin ratio. Now when you go to the hospital, the doctor will tell you, take 4 units of insulin, take 2 units of insulin, take 5 units of insulin. I hope you are getting me. And most of this insulin is, the ratio is 1 is to what? 15. Some 1 is to 10. But majority of it is what? 1 is to what? 15. That is 1 unit of insulin to what? 15 grams of what? Carbohydrate. So if you are taking 4 units of insulin. If you are taking 4 units of insulin, that means how many grams of carbohydrate are you supposed to take? Please, you should answer me so I know that I'm communicating. I said that most times the insulin to carb ratio is 1:15. That is 1 unit of insulin to 15 grams of what? Carbohydrate. Now, if you go to the hospital and the doctor tells you to take 4 units of insulin, how many grams of carbohydrate are you meant to eat? 60 grams of carbohydrate. I hope you are getting me. And with all this method, I've been able to show you how you can do what? Calculate your what? Carbohydrate. Next slide. So tips for accurate carbohydrate counting. Use measuring tools. Like I explained. Keep a food diary. Make sure that whatever you eat, you are writing it down. Maybe after eating, you check your sugar level. Record it. Anyone that do what? Brings your sugar level down or higher, you record it. So that you know what to eat, what to do next time. Then practice portion visualization. Like we talk about half cup of rice. When you bring that half cup of rice, you can decide to do what? Mold it. You can say that maybe my fist is what? Half cup of rice, or is equal to what? 15 grams carbohydrate. When you do this, you can do this practical in your home, so that even when you are outside, you'll be able to calculate it even without using your what? Your weighing scale. I hope you are getting me. Then also say recheck with what? Dietitian regularly, especially as the child grows. Now, for example, if you are taking 4 units of insulin and you are 4 years, when you are 5 years, do you think it will still be 4? Because the child is what? Growing. The activity level has what? Changed. The age has what? Changed. So it means that as the child grows, you keep on going to what? Dietitian, so as to plan or to increase the what? Calorie according to the child's what? Age. I hope you are getting me. Next slide. Conclusion. Carbohydrate counting can be challenging at first, but with training, consistency, and teamwork, it becomes what? A routine. Yes, at that first instance, it will be what? Very difficult. How to measure this, how to bring this, maybe after cooking right, how to put it in a cup and discharge and all that. It will be what? Challenging. Once you are consistent with it, if you can do it for 1 week, 1 month, other ones will be what? Will be a simple case for you. Do you understand? But regular practice will make you to be what? Perfect. Thank you very much.